Okay, let's talk about something that, for a lot of people, brings up a whole mix of confusion and, let's be honest, a little bit of anxiety: the vaginal exam. But what if we could totally reframe it? In this explainer, we're going to break this whole thing down and turn it from something you might dread into a tool that actually empowers you. Right off the bat, I want you to completely change how you think about this. A vaginal exam, it's not a test. There's no passing or failing. It is not a judgment on you or your body. From now on, I want you to think of it as your labor's own personal GPS. It's the tool that gives your medical team a super precise, real-time map of your unique journey to delivery. You know, for the longest time, medicine was using this really outdated map. It was called Friedman's curve, and it was basically this rigid, one-size-fits-all rule from the 1950s that said you had to progress 1 centimeter every single hour. But we know so much more now. Modern, evidence-based care, backed by big names like the World Health Organization, has moved on. We now know every single labor has its own unique fingerprint, its own pace, especially in those early stages, before you hit that 6 centimeter mark. So what is this GPS actually measuring when a provider does an exam? Well, they're not just guessing. They are tracking 4 very specific data points. Let's call them the 4 pillars of progress, to get a crystal clear picture of exactly what's going on in the, let's say, engine room. All right, pillar number 1 is dilation. You've probably heard of this one. It's measured from 0 to 10 centimeters. Now, a great way to picture this is to think of a turtleneck sweater. At the start of labor, your cervix is like that tightly closed neck. But as labor progresses, it opens up. And by the time you're at 10 centimeters, poof, that turtleneck has completely opened up, creating the path for your baby. Next up, pillar number 2, effacement. Now, this is a big one. Before the cervix can open wide, it has to get thin. We're talking about going from a 2-inch long tube to becoming as thin as a single sheet of paper. And for first-time moms, this thinning process is huge. And a lot of the time it's happening before you even see big changes in dilation. Pillar number 3 is called station. This basically tells us the altitude of the baby's head as it makes its way down into the pelvis. Your provider feels for these 2 little bony points deep inside your pelvis. They're called the ischial spines, and they use them as a landmark. This gives us a measurement from -3, which means the baby is still floating high up, all the way to +3, which means, well, they're almost here. Okay, to make this super easy to remember, let's picture the baby moving through a building. At -3 station, the baby's way up high in the penthouse. Once they reach 0 station, they've made it down to the lobby, and that means they are officially engaged in the pelvis. And at +3, they are right there at the exit. That's crowning. And finally, our 4th pillar, membrane status. This is pretty simple. We're just checking to see if your water bag is still intact or if it has ruptured. And if it has, we take a peek at the color of the fluid. Clear is what we want to see. But if it's green or brown, that's something called meconium, and it just tells us the baby might be a little stressed out, so we'll want to keep a closer eye on things. So now we know what the GPS is measuring, but you know what's just as important? When and how it's used. This is where the rules of the road come in, and they're all designed to make sure we're talking the absolute safest route for both you and your baby. And the number 1 rule is this: in a healthy, normally progressing labor, exams should only be done about once every 4 hours. Let me say that again because it's important. Not every hour. Not every time a new person walks in the room. The standard of care is 4 hours. So why the 4-hour rule? Why wait? Well, the data on this is crystal clear. Every time an internal exam happens, there's a small chance of introducing bacteria. And research shows that doing exams every 1 to 2 hours can actually increase the risk of a serious uterine infection by a whopping 15 to 20%. And here's the real kicker: doing them more often doesn't even speed up the birth. Now, of course, we will break that 4-hour rule if we see any red flags. Things like you feeling an intense, overwhelming urge to push, a sudden big gush of fluid, if we see signs of fetal distress on the monitor, or if there's any abnormal heavy bleeding. These are all critical safety checks, and in those cases, we'll absolutely check sooner. All right, now for one of my favorite parts. Let's tackle some of the biggest myths and misconceptions that create all that anxiety around vaginal exams. We're going to clear up these traffic jams of misinformation with some cold, hard facts. First up is a really common and frankly dangerous myth. It's this idea that your doctor or nurse is, manually stretching your cervix to try and speed things along. Let me just be as clear as I can possibly be here.
This is absolutely not what should be happening. It's a harmful practice. Forcing the cervix open causes those delicate tissues to swell up, which actually makes it harder for you to dilate and can even lead to tears. A provider's job is to measure, not to manipulate, period.
Okay, another big fear I hear all the time: will the exam itself rupture the membranes and break my water? The reality is, a standard gentle exam just doesn't have the kind of force it would take to break that strong bag of waters. If your water happens to break while an exam is going on, it's because that sac was already under a ton of pressure and was basically ready to go on its own. It's a classic case of coincidence, not cause.
Oh man, this one is so common and so frustrating. You've been in labor for hours, the contractions are intense, the pain is real, and then the exam shows you're only 3 centimeters. It can feel so incredibly defeating.
But listen, progress is so much more than that one number. Massive, critical, important progress is happening with those other pillars. Maybe in those hours you went from being 0% to 80% effaced. Or maybe the baby descended from a -3 station all the way down to -1. Your body is doing absolutely incredible work, even when that dilation number seems stuck. And all of this, it brings us to our final and maybe the most important point. Knowing all this stuff is designed to put you firmly in the driver's seat. So let's talk about how you can co-pilot your birth experience using clear communication and consent. I want you to put this question in your back pocket. Don't just settle for vague updates like, "Oh, you're doing great." Ask this specific question to get the whole picture. What is my dilation, my effacement, and my station? Get all 3 numbers from your GPS. And please remember your rights. If an exam is suggested sooner than that 4-hour mark, you have every right to ask, "Why now? What's the reason?" You have a pause button. You can always ask to wait for a contraction to pass before they begin. And you should know that a membrane sweep is a totally separate procedure to try and induce labor, and it requires your explicit, informed consent first. The goal with all of this is to build something called realistic optimism. This isn't about pretending there won't be challenges. It's about facing them armed with facts. When you understand the process, you're no longer just a passenger along for the ride. You become an active manager of your own birth experience. Let's end with this really powerful thought from Dr. Prashanth. Your medical team is there to be your guide. They are watching the harmony of your body, not just the clock. And trusting that harmony, understanding your own body's journey, that is what this is all about.